My name's Sarah Burton and I'm a Macmillan Gynae-Oncology clinical nurse specialist based in Velindre Cancer Centre in Cardiff. In the past, unfortunately, our patients did have to wait sometimes up to 3 or 4 hours to be seen in a consultation that maybe would only last 5 or 10 minutes because they were feeling well. We asked our patients whether or not they would be happy to see a nurse specialist instead of a consultant. So that's when we put together the nurse-led survivorship clinic for women with ovarian cancer.
Sarah's realised that it's really important to have the right professional in the right place at the right time for the benefit of the patient. Traditionally, there could be up to a 4-hour wait, and with the change Sarah's implemented, that's reduced down to 15 minutes. Also, patients may have seen only a doctor, and Sarah has implemented a nurse-led clinic where she can do the follow-up.
As well as their sort of physical being, I also wanted to address any survivorship issues that they may have and look at their holistic needs. It also frees up the consultant's time to be able to see patients who are actually much more complex and maybe more poorly.
The patients have evaluated this service and we've had 100% satisfaction.
My name is Gynae and I had ovarian cancer. Sarah was my nominated Macmillan nurse when I came to Velindre, and she has been a tower of strength to me over the past 3.5 years. She explained to me what I was going to have and how I was going to feel, and not to forget, she was on the end of the phone.
She's also introduced a psychosexual clinic, unique in the UK, which is all about the rest of the patient's life. So things like, how they're doing with their work, any family matters, and of course relationship issues, because some of the treatments that patients have really interfere with relationship, intimacy issues, difficult to address issues in lots of clinical scenarios, and Sarah has addressed that and been able to share those findings both nationally and internationally.
I was always trained to treat my patients the way that I would want to be treated. So for me, I want them to have a gold standard as a service, and it's what we can do to actually make that happen.
Sarah is always thinking of the patient. She always seems pleased that you've been to her with your problem. I'm 77 years old now, and I've never met anyone who's been so helpful to me in the whole of my life as Sarah has been.